Hello everyone, I'm Renee Mehrra and welcome to Your Health Matters, our innovative series with healthcare experts providing the deep insights into critical health issues so we can maintain good health. I'm here at CarePoint Health in Hudson County, and CarePoint Health is the largest healthcare provider in Hudson County, catering to a very large ethnically diverse population in the entire country, with 3 facilities in Bayonne, Christ Hospital in Jersey City, and Hoboken University Medical Center. Today we'll be talking about women's health because woman is the epicenter of the family. She's a caregiver, a homemaker. If she's healthy, her child is happy, her family's happy, the community is happy. So talking to me on women's health, we have CarePoint Health physicians, Dr. Tucker Woods, Chief Medical Officer at Christ Hospital in Jersey City, Dr. Rakhi Patel, Obstetrics and Gynecology. She's attending physician at CarePoint Health. Dr. Ramila Devi Patel, she's a primary care physician at CarePoint Health. And Dr. Amy Sungdam Brong, reproductive endocrinology and infertility specialist. Thank you all for joining us today. And as I mentioned that women's health is so very, very important. She plays a pivotal role in the family. So Dr. Woods, tell us, I know that you have women's health services across the 3 settings, 3 facilities. Share with us, with our viewers, what services you have for women and how they can partake these services.
Yeah, you're exactly right. So at CarePoint Health, women's health care, it's an essential service we provide, and we provide a wider range, the full spectrum of women's healthcare services. We provide obstetrical care, gynecological care. At Hoboken, we actually have what's called the Institute for Women's Health. And our providers, although they're based out of Hoboken, our providers extend throughout Hudson County. And what's unique about the Institute for Women's Health is we provide obstetrical care, GYN, reproductive health, pelvic pain, incontinence, and many other additional services. So we really provide that full spectrum of care, and we're doing a great job with our women's health care services.
Okay. Dr. Rakhi Patel, we're talking about women's health today, across the decades, with 20s, 30s, 40s, 70s, 80s, and each decade there's different priorities, different concerns. So when we're looking at a gynecologist, and at what point of a woman's life should she be choosing a gynecologist and going to a gynecologist?
So that's a very good question. That is a little bit difficult to answer because women may need to come in their early teenage years, especially if they're having any concerns, but definitely we recommend to all patients by 2021, you should at least be having a conversation with your gynecologist. The needs of each patient are different, so whether they're having period problems or if they're active or if they have other concerns or issues, they may need to be addressed sooner than 20 or 21. So that's where we're really working with their primary care and their pediatrician to help decide when is the right time for them.
Right. So for each person, it could be different.
Absolutely.
But by 2021, they definitely should have a gynecologist.
Yes, and we recommend that for a multitude of reasons. One is we start pap smear screening for cervical cancer, which is important for all individuals, whether they're active or not. We start optimizing their care for future anticipation of pregnancy. We want to also optimize any medical problems they may have that we may foresee cause problems later on. So definitely getting early care is important rather than putting it off and being afraid. We really welcome patients to pick somebody that they feel comfortable with so they can start their care as soon as possible.
So you have these preventive screenings. Are there any risk factors involved with certain conditions, health conditions?
Absolutely. There are many risk factors that can be involved depending on what you're screening for. So if a patient is active, that's where cervical cancer screening is very important. If the patient has any period menstruation problems, that can play a factor in possible infertility and future childbirth.
So it can go, to something on the long haul
Absolutely.
as well.
Something very small you may not realize but can have a major impact on your future health. So getting early care is essential.
So that's why it's important not to be embarrassed talking about your condition to a gynecologist, to a primary care physician. And Dr. Ramila Patel, you tell me, because I think specialists and primary care work together, bringing the continuum of care for the patient, for the woman. And to optimize the care, they come back to you. They should be going both to a primary care physician and to a gynecologist. And what role do you play at that time?
Well, the primary care provides a total care to the patient as a whole. And as all female patients should establish a long-term relationship with their primary care physician with whom they are comfortable with. And they should start having physical screenings as early as possible, starting age 18, in order for us to make sure that they are in good health, because going forward they will be planning pregnancy, and we want to make sure that they're up to date with their vaccinations, especially rubella vaccination, which needs every female patient must have that before getting pregnant. The second thing is all female patients, and of course male too, needs to get their HPV vaccine. Anywhere from, they can have this vaccine anywhere starting as early as at 9 years old to age 26. HPV does increase the risk of cervical cancer, and therefore it's very important for them to have this vaccine to prevent that. The third thing, the PCP also can do, just like the gynecologist, a pap smear. And if they don't want to see a gynecologist at that point and they're otherwise healthy, we can do the pap smear. These are the main reasons why a female should start having physical early. And not only that, even though you are young, you may still be may have some sudden medical illness you are not aware of. And we need to do the screening and make sure that your health is optimized before you get pregnant, which may happen anytime going forward.
Because it's going to impact the fetus as well.
And it can impact the fetus also. So, of course. And all patients have to, as I said, have to have a primary care physician to whom they can go to. Even when they get pregnant, sometimes they have medical acute illness for which they have to seek care from a primary care physician for antibiotics. Right. So in coordination with the OBGYN, we do provide that care. They may have other medical conditions like high blood pressure, thyroid condition, that we also work with the OBGYN to monitor that and manage that during pregnancy. After the baby is born, they continue to see the primary care physician for an ongoing regular checkup and care of their chronic medical problems. As they grow older, there are other things that a primary care physician can help you monitor. Well, as you grow older, with elderly, their problems are unique, as you know. Right. As you grow older, you have issues with urinary incontinence. You may even, after menopausal period, you may develop bleeding and you may just ignore that. But if you have a primary care physician, you reach out to her and who can appropriately direct you to GYN for further evaluation. Right. Because a postmenopausal bleeding is never normal. That's right. And of course, in the postmenopausal period, we need to do osteoporosis screening and so forth. Yeah.
So coming back to pregnancy, that's very important that, before you go for having a baby, you got to optimize your care so that, it's going to affect the whole family in the end. So that is important. So, you're going to tell us all about the pregnancy and the trimesters, but we're going to take a quick break and then going to talk to Dr. Rocky Patel about care during pregnancy. Stay with us. We're back and we're talking to CarePoint Health physicians on women's health. Dr. Rocky Patel, tell us when a woman decides, okay, she's going to have a baby now, and we talked about optimizing care with a primary care physician. Now tell us, she's pregnant and how she's going to be taking care of herself, whether it's a diet or exercise through the trimesters.
Sure. So when you first have your first appointment with your OBGYN, it's such an important appointment because we go over so many things that are crucial to the next 9 months of your care. We discuss diet, and we can really get down to the nitty-gritty about specifics, whether it's the rice or the roti or the ghee, that is really specific to our patient population that only maybe certain physicians of cultural background may be able to relate. It's very important for the diet because we do screen all of our patients for diabetes. We talk about exercise and how it's important. We talk about travel precautions, whether it's safe to go back to India or Pakistan or wherever they may be traveling. We talk about, not with the diet specifically, safe foods and foods that we want to maybe minimize and avoid, especially limiting our caffeine intake. We talk about activity level. We talk about immunizations to see if they're up to date, especially flu vaccine and Tdap. We're talking about weight gain. It's very important that the patient is not gaining 40, 50 pounds because that's going to increase their risk for becoming diabetic.
So in the first trimester, how much weight should a woman be optimally gaining?
So generally we counsel our patients that it's going to be anywhere from 20 to 30 pounds for the entire pregnancy. If the patient is on the smaller side, we may increase that to 35, 40, and if they're larger, it's going to be less. We never put a patient on a diet, but we do have them think twice about what foods they're taking in because it does directly impact the growth of their baby. So it's very important.
So the first trimester that you talk about travel precautions?
Yes. So many patients in their first trimester, they may or may not experience morning sickness, which is nausea and vomiting. A lot of times people just feel very, very tired and exhausted, and they're concerned if this is normal. So that affects kind of their daily activities and living. So that might not be an optimal time to travel. The airlines kind of have specific rules and guidelines after a certain time, generally around 32 to 34 weeks they're limiting travel because there's a concern for early delivery. And the last thing you want is to be in an airplane in the middle of nowhere and have an obstetrical emergency.
Right. So, and then the last trimester is again very important.
Right. So the first trimester is educating the patient, making sure they have the right tools and resources, where to go, what are emergency precautions. The second trimester is making sure we continue our screening for blood pressure, diabetes, weight, growth, checking the anatomy. And the third trimester is really when, the mother is preparing for those final stages of childbirth and delivery. So it's a different level of kind of preparation that we're advising her on.
I see. And if, it becomes like a cesarean, that becomes a little bit of a complication?
Yeah, so we always try for a vaginal delivery unless the patient has a medical condition that precludes it, whether the baby's breech, so that's when the head is up here versus down here, that could be a serious emergency, or if the patient has very high blood pressure or they're not controlled with their diabetes. But we always try to have the patient strive for a vaginal delivery because in general the recovery may be a little bit easier. However, there is always the possibility of a cesarean section, but it's not as common as a vaginal delivery. But yes, there are different kind of aspects that pertain to the patient's recovery and the postpartum care, in addition to taking care of this newborn child that they have.
So now the woman has a baby now, so that's great news. And now we're talking about post-pregnancy health. And the baby's health too.
Absolutely. So any mom out there knows that once you have a baby, your life completely changes. Whether it's just getting used to the late night feedings and not sleeping, but really I see a big problem is that the moms are kind of negating their health and not really paying attention to it, whether they're leaking urine or they're having pressure or they're having pain or they're having some concern and they neglect it. Because after pregnancy, they have to remember that 9 months of the pregnancy, it stretches out a lot of muscles and ligaments, and you need to exercise and do specific exercises that help re-strengthen those muscles. So if they plan for pregnancy in the future, they don't suffer as serious consequences when they're older.
So they have to lose that weight back, again.
Yes.
Because many women get into depression because of that as well.
Postpartum depression is very, very serious, and a lot of women don't talk about it, unfortunately. And hopefully you pick a provider that screens you for it. So even if you don't feel comfortable asking, they're screening you for it.
Yeah. When is it safe to travel for a woman who's pregnant?
That's going to vary. So if the patient's in their first trimester and if they're having a lot of morning sickness, like nausea and vomiting, and if they're feeling very tired, getting on an 8 to 10 hour flight may not be optimal. However, if the patient feels fine, they can do it. A lot of times, airlines will restrict travel about 32 to 34 weeks, and that is for concerns of if you go into preterm labor. The last place you want to be is 50,000 feet up in the air and have an obstetrical emergency and have no care. What's really important is I advise patients that when they do travel is to review the CDC website to avoid any areas where there's the Zika virus. The CDC has done a great job at eliminating like Caribbean countries one by one, but Zika is very important. So even if the patient has traveled to one of these areas prior to conceiving, they want to make sure that they're appropriately screened before they get pregnant.
Dr. Rakhi Patel, in addition to pregnancy, a woman has to go to a gynecologist. What are the other reasons? Share with us.
So generally, a woman should come at least once a year for what's called a woman wellness exam. So at that visit, it's pretty general, but we'll go over a breast exam and kind of educate them about what are some things that if they notice that they should come to the doctor sooner. We go over general medical concerns. We go over period type issues if they're having pain. We discuss contraception. There's a lot, and we also do our pap smear screening as we talked about earlier. So it's kind of like a general appointment that should be addressed at least once a year. Now, if your gynecologist picks up on a concern or an issue or a finding during your examination, that can lead to a further workup. So a lot of times we'll talk about period problems or menstrual problems. So whether it's appropriate for the patient to be on some type of hormonal control because they're bleeding too much, or they have so much pain, or if the patient has pain in general. Other concerns that might be addressed is bleeding after they're in the menopausal status. As Dr. Patel had discussed, postmenopausal bleeding is very serious. You do not want to take that lightly because there's always a concern for cancer. Right. So you don't want to wait because the more information you and your doctor have, it can be life-saving and very, very important to your future health and outcome.
I see. We'll take a quick break, and when we come back, we're going to talk about infertility issues with Dr. Amy Sungdamrong. Stay with us. We're back and talking to CarePoint health physicians on women's health across her lifespan. And we're talking to Dr. Amy Sungdamrong. We talked about pregnancy, we talked about post-pregnancy, now we're talking about women who may have difficulty in conceiving, and there could be a primary infertility issue or a secondary. So tell us, at what stage does a woman come to you as an infertility specialist?
Infertility is a really common problem, and it's very difficult for women to talk about it. Yeah. We have a lot of women in our community who have a great desire to have a baby. They have a lot of family support for reproduction, for growing their families, and if it doesn't happen very quickly, it can be very frustrating, very isolating.
A lot of stigma over here.
Absolutely, absolutely. So we usually find that within a year of trying means having regular intercourse, that we should see a pregnancy within that time frame if everything is okay. About 10 to 15% of couples who are trying regularly do not get pregnant within that first year. And that is the set of couples that we really aim to help. We define infertility in a primary sense as having a year of trying without a pregnancy. Now, secondary infertility is if you've had a baby before and everything worked fine, but you are now unable to get pregnant. So secondary infertility can happen for many reasons: age, complications from surgeries, infections, male problems, female problems. The same with primary infertility, but many women are a bit surprised if they've had no trouble getting pregnant with one or two children and then now have trouble getting pregnant with another.
Many women, they want to first concentrate on their careers, so during their fertility years, they may not be thinking of having a baby as a priority, and down the road, there could be an infertility issue, or if they can, what other option they may have? Could it be freezing their eggs?
Sure, that's a very big topic right now. So naturally, reproduction or the ability to become pregnant starts with one's first period. Now, that is just the body's opportunity for having a pregnancy. In our modern society, many women delay pregnancy into their 20s, into their 30s, and now even into their 40s. What we do see in those later times of life is that we start to have fewer eggs, and the eggs do not work as well. So we see poor embryo qualities, which means they lead to miscarriages or more difficulty getting pregnant, infertility. So there are ways to save eggs. One way is to freeze one's eggs, which means to take them out of the body, freeze them, save them for later, and at the time that one wants to get pregnant, they go through an in vitro fertilization process and put an embryo into the uterus. And that is very helpful in that the egg's potential is saved at the moment and the time and the age at which they were frozen. So we see fewer errors that lead to miscarriages, an easier time to conceive. With older ages, there can be a time where we do not have the ability, even with egg freezing, to save eggs, or we do not have the ability with IVF to achieve pregnancy, in which case we are not able to use one's own genetics to achieve a pregnancy with one's own egg.
So what other options would a woman have?
Right, so aside from egg freezing, we do look at egg donation if the time has passed where we can help the eggs or save them. Egg donation is widely available. It is fairly straightforward at this time. There are egg banks that have eggs that are already produced, screened, safe, effective. There is also the use of a gestational carrier if one's uterus is not able to carry a pregnancy.
Is it like a painful procedure?
Egg freezing in vitro fertilization involves several weeks of growing eggs with medications. They are injectable medications, but they are very easy to use. The in vitro fertilization process, which happens in the laboratory, does require that we do a procedure, a short 10 to 15 minute procedure called an egg retrieval. It is done under anesthesia but without any incisions on the belly. So it is slightly uncomfortable but very well tolerated, and certainly the benefits are great.
So as soon as you're talking about women's health across her lifespan, so we're talking of 20s, 30s, 40s, 50s, and then we're talking about, as a woman is growing older, past her reproductive years, what are some of the concerns that a gynecologist and a primary care physician should be looking at for a woman?
So there's many things. Most people recognize getting a mammogram or a breast exam because breast cancer screening should start at age 40, sometimes sooner if there's a strong family history. We're also looking at, as Dr. Patel had mentioned before, colon cancer screening, bone screening for osteoporosis, because as a woman goes through menopausal status, there's many symptoms she may or may not experience that will affect her future medical problems. So a woman may experience hot flashes, maybe more urinary tract infections. She might experience vaginal dryness. She may not have a desire to be intimate with her partner. These are very, very important symptoms that a patient may feel that may make them internalize them and not talk about them. And that could lead to an overall state of sadness or being introverted and not seeking help for these problems that there's many treatments for.
So that is very important that we want to share with our viewers. If you feel you have these symptoms, don't be embarrassed or scared. Talk to your primary care physician, talk to your gynecologist, because they can help you instead of just sharing it with their friend. Even the friend should be responsible enough to tell them that please talk to your doctor about this, because they can help you to treat those issues and concerns.
Yes, there's hormonal options, there's non-hormonal options, and listening to your doctor is so important because your friends may not know the whole story. Google cannot.
Yes.
A lot of people overdiagnose or self-diagnose incorrectly, and these can be things that can be easily fixed and have a huge improvement on your quality of life.
Some cultures you just feel isolated. You don't want to talk about it.
Absolutely.
Especially if a woman has just come from a South Asian country and they don't have too many friends or social support, and you don't know where to go and what to do.
You really want to pick someone that you feel comfortable with, and I think identifying a physician of a similar background helps because you're going to mention more rather than saying less.
That's right. So Dr. Woods, we talked about women's health across the decades, across her lifespan. It's so very important that women should take care of themselves, and men who are also watching the show, please take care of your women, and women should take care of themselves. And the kids too should see that their moms are okay, their sisters are fine. So this is very important. And you know, coming from South Asian families, it's a cohesive unit. So this is important that women should be healthy to maintain good, healthy families. Your final thoughts on it, Dr. Woods?
Yeah, what I like about the conversation today is it's so important for women to get health care from start to end throughout their life, and it's important for you to pick a doctor, and when you do go to your doctor, tell your doctor all your symptoms, because they need to know everything, and you can have that comfort level with your physician, and it'll make a big difference. You want to stay healthy throughout your lifetime, and your doctors are there for you, and they'll make sure you're getting the proper medical care so you do stay healthy.
The biggest takeaway, please see your primary care physician on a regular basis for preventive screenings, as well as your gynecologist across your lifespan, whether it's reproductive years or after your reproductive years, or where there could be issues, infertility issues, or any other concerns that you may be having. They are there for you, and help is on the way if you just give them a call and visit them on a regular basis. I want to thank Dr. Tucker Woods, Dr. Rocky Patel, Dr. Urmila Devi Patel, and Dr. Amy Sung Damrong. I'm Renee Mehrra. Thank you so much for watching Your Health Matters. Stay healthy and stay positive.